Hello and welcome to this webinar entitled CFPN Certification Essentials. CFPN is a fairly new perioperative nursing related credential that originated in mid-year of 2021. CFPN is an acronym which stands for Certified Foundational Perioperative Nurse. Essentially, CFPN certification establishes a standard of baseline perioperative nursing competency and is designed to be a first step in the professional development journey of new perioperative nurses. Although a specific title or position is not required as part of the eligibility criteria for the CFPN credential, it is targeted to the early stage of the perioperative career path. Before we get into our objectives and content, we need to review this disclaimer. Because CCI is a certification organization and has a role in developing and administering certification exams, we do not, nor are we allowed to require or endorse any specific study guides, review products, or training courses. So that means that you as a candidate can prepare for any of our certification exams with any educational materials you may choose. So purchase of CCI review materials is not a requirement for testing, nor does use of any of our materials imply successful performance on any of our certification exams. So no study resources are prerequisites for any of our certification examinations. So here are our objectives for this webinar. At the end of this webinar, we hope you are able to appreciate the value of certification, review development of the CFPN credential, describe eligibility requirements for CFPN certification, examine subject areas of the CFPN exam, discuss resources available to you to prepare for CFPN certification, and last but not least, review key processes associated with earning CFPN. So, our first objective, appreciating the value of certification. It's best to begin with a definition of certification. Certification is defined by the American Board for Specialty Nursing Certification, or ABSNC, is the formal recognition of the specialized knowledge, skills, and experience demonstrated by the achievement of standards identified by a nursing specialty to promote optimal patient outcomes. Now, it is important to note that CFPN is accredited by the American Board for Specialty Nursing Certification, or ABSNC, and therefore is eligible for consideration on the Magnet Demographic Data Collection tool. So, advantages of certification, and there are a variety of advantages. For example, certification, it's a great tool to demonstrate our commitment to proficiency in practice to the public. It's a measure of our personal accountability to validate our competence within the specialty of perioperative nursing. And the achievement of certification can be an important part of personal satisfaction. So with CFPN, an individual can take charge of their career and earn a credential early on in that career. Now, obviously, these are just a few of the advantages, and I'm sure many of you all can think of several others, because there's benefits to our patients, us individually, our profession, our facilities and employers. So when we think about documenting competency, our facilities and our employers' benefits include documentation of our competency as a perioperative nurse, and this is done via a well-documented test, a psychometrically sound test of our perioperative specific knowledge. Also, CFPN fits well within the American Nurses Credentialing Center's Magnet framework, as well as their practice Transition Accreditation Program, or PTAP framework. So CFPN is an avenue to increase certification rates. We've already mentioned the magnet demographic data collection tool. And then it can also serve as a step in professional development planning for nurse residents and fellows that are part of a PTAP accredited program. So why CFPN? Well, many nurses who enter perioperative nursing, they do so at an entry level with minimal to even no prior experience or exposure. With that said, there really is no standardized path to become a perioperative nurse, and therefore it's largely an employer-driven process. In addition, there's a gap between the end of one's perioperative nursing orientation and when that individual is eligible for the CNOR or CNAMB exam, because the criteria for that is 2 years in the profession and 2,400 hours of practice. And then there's simply an ongoing need for continuing professional development. So how do we address all these issues? Well, we believe CFPN is one strategy, with the CFPN being a professional development opportunity for nurses who have recently completed a perioperative nursing orientation program. Now, that orientation program can be one based on AORN's Periop 101 curriculum, or it can even be a facility-based orientation program. And we'll talk more about specifics about the orientation program in just a few moments. So CFPN is really considered a bridge for continuing professional development. So when we think about the core features of CFPN, if you will, CFPN is for those nurses who have recently completed a perioperative orientation program. Now, CCI does not, nor can we, endorse any particular program. So all we say is that proof is needed that you completed a perioperative orientation program and that you have a certificate of completion for that. The program must have both a didactic or classroom component as well as a preceptored clinical component. Now, CFPN, once earned, that credential is good for 2 years, and then it expires. There is no recert mechanism with CFPN, so there's no renewal. However, CFPN is designed to lead you or bridge you on to other perioperative related credentials, such as the CNOR or CNAMB. So in the language of credentialing, CFPN can be viewed as a stackable credential that leads you on to other credentials. Another important thing about CFPN is that early on in a nurse's career, it connects them to all the resources available to them at CCI, our learning management system, and all the continuing professional development offerings housed within that learning management system. So again, CFPN is a time-limited bridge certification with no renewal, but it is designed to bridge you to your next perioperative certification, such as CNOR or CNAMB. An additional benefit for CFPN holders is that a CFPN nurse will be eligible for CNOR or CNAMB at 2,400 hours of practice and 18 months of experience compared to the typical 2 years, barring they meet all the other eligibility criteria for a given exam. And that clock starts on day 1 of their orientation. Also, CFPN nurses can purchase a digital badge that provides documentation of the various knowledge, skills, and aptitudes that were demonstrated via the CFPN exam. So let's kind of explore a little bit now the development of the credential. CCI periodically conducts test development activities to capture the current knowledge and skill set required of perioperative nurses upon completion of their orientation. Now, a complete list of the CFPN task and knowledge statements is available on our website, and we'll talk about those a little bit more in just a few moments. But these task and knowledge statements, they're developed using the results of a job analysis, and they really constitute the blueprint, if you will, for the exam, which must be completed successfully to earn the credential. Again, all of the task and knowledge statements are available for download on our website. Now, it is recognized that the task and knowledge statements may not reflect all specific tasks performed by an individual functioning in this role, especially in niche or highly specialized environments. But with all that said, the CFPN exam is developed in accordance with psychometric best practices and principles in the certification industry. So the exam is psychometrically sound, subject to third-party oversight, and written in the same style as CNOR or CNAMB. The exam content reflects the knowledge required of the perioperative nurse, and the input and guidance of subject matter experts provides evidence to support the inference that those candidates who pass the exam are qualified to practice in their job role. Now, currently, the CFPN exam is taken online via a remote, secure, and proctored exam experience provided by our testing vendor, PSI. However, we encourage you to always check our website for the most up-to-date information about testing options. The exam is 120 multiple choice questions. You have 2.5 hours to complete the exam, and the results are pass-fail. Now, the CFPN certification requires that the candidate have a thorough and sound foundation of the knowledge and skills required for competent perioperative clinical practice. And this knowledge can be obtained through work experiences, independent learning, or even formal educational programs. So the CFPN exam is based on what a registered nurse in the perioperative setting is expected to know upon completing their orientation period. The exam assesses a combination of experiential and cognitive knowledge of competent clinical practice. An understanding of the test-taking process applicable to the exam is important because applicants do need to successfully demonstrate competency by responding to those 120 multiple choice questions. There is a detailed tutorial on answering multiple choice questions that is provided at the beginning of the exam. I mentioned digital badges a moment ago. Now, nurses who earn the CFPN credential can purchase a digital badge for an additional fee, and this digital badge is an active link to a repository of information. It's almost like a resume on steroids. You can share this when you do interviews or with your supervisor to review your accomplishments. It describes the various areas that are covered on the test, but it does not display your score. So when we think about digital badging really has the potential to provide even more than just pride and certification, because when you have a digital badge, you can demonstrate your achievement or achievements in acquiring new skills. You can promote and amplify your own personal brand by showcasing your badges in your email signature lines, on social media, in your resumes. They help with developing our careers by allowing us to achieve mastery in skills that are most needed in a dynamic work environment. And with this model, CCI really is your partner. We are our certificates partner beyond just them attaining their certification, but also helping them to develop in their career and supporting them in their continued professional development. Now let's move to our third objective, where we're going to talk about the eligibility requirements for CFPN. To earn the CFPN credential, applicants must meet all eligibility requirements at the time of application and pass the exam. One requirement is that you hold a current unrestricted RN license. You do need that certificate of completion from a perioperative nursing orientation program, again, that has a didactic classroom as well as a clinical preceptor component. Now, we do random audits. So if you are selected for random audit, you would be required to submit the course syllabus and outline as part of the application process. And an application does need to be submitted within 23 months after your initial hire in the operating room, because CFPN must be earned before you reach that 24-month or 2-year mark of experience. And then, of course, another eligibility criteria that you are currently working either full or part-time in perioperative nursing. And this could be in clinical practice, nursing education, administration, or research. But again, I do want to highlight, once you reach eligibility for CNOR or CNAMB, which means 24 months or 2 years in the perioperative setting, your eligibility for CFPN ends, because then you are eligible for CNOR or CNAMB. So let's talk about the test a little bit, the exam, the subject areas that are covered. This slide is comprised of the various subject areas of the exam. You see those subject areas listed there. You also see the percentage of test questions in the respective areas. So you can see there's content on pre- and post-operative assessment, diagnoses, individualizing a plan of care, determining expected outcomes, managing intraoperative activities that ensure safe patient care, managing materials, personnel, and services, communication and documentation, infection prevention, control of the environment, emergency situations, and last but not least, professional accountability. I would also like to call your attention, if you look at those subject areas, you can see the nursing process embedded throughout those subject areas. Now, task and knowledge statements. We mentioned these a little bit earlier. Each of those subject areas that I just showed you is further broken down into those task and knowledge statements that are, again, available on our website for download. The task are those nursing skills, perioperative nursing skills. So what you, the candidate, should be able to do. The knowledge statements, which is the information that you need to provide competent perioperative nursing care, are basically what you, the candidate, should know. Now, here's an example of the subject area number 2, along with the task statement and the knowledge statements. And again, these are available for download on our website. In preparing for the CFPN, I would encourage you to download the task and knowledge statements and use those to complete your own self-assessment, which will help you identify your strengths as well as your potential weaknesses, and that can be used to craft an individualized study plan. So, what the CFPN exam is and what it isn't. The CFPN exam is designed to validate your knowledge of current best practice, evidence-based practice. It's a reflection of ideal practice. So when you are answering the questions, you are not having to worry about short staffing or not having adequate resources. And remember, it's developed for a novice perioperative nurse who's just completed orientation. It's important to remember and keep in mind when answering the questions on the CFPN and preparing that it is not based on individual practice or hospital policy. And it's not focused on a single surgical specialty or patient population. So you could have questions related to pediatric patients, geriatric patients, ortho, plastics, cardiac, ophthalmology, just as a few examples. So now that you know kind of the structure of the exam, what are some resources that are available to you to prepare for the exam? Now, the recommended study period to prepare is 3 months. Again, we highly encourage you to review the task and knowledge statements to help you identify your individual strengths and weaknesses. And then using that, you can align those identified areas for additional study or experience with our CFPN study plan, which is a free download on our website as well. And we'll talk a little bit more about that in just a few moments. You need to keep in mind how many questions or what percentage of the exam is contained within each of the subject areas being studied. And also use a variety of preparation aids and have frequent study sessions, studying in chunks. All this has been found to increase comprehension and retention of information. So the questions on the CFPN exam, they are all based on current national standards of perioperative nursing practice. They're based on the professional guidelines and they're evidence-based. The reason for this is these questions do need to be based on information that is universally accessible to all of us. We mentioned using a variety of resources to prepare, and this is important to keep in mind because no single resource will likely meet all of your learning needs. So what are some highly recommended resources? Well, first, we definitely recommend the AORN guidelines for perioperative practice, as well as AORN's various position statements. There's also a few textbooks that we highly recommend. One is Alexander's Care of the Patient in Surgery. You can see the current edition depicted for you here, which is the 17th edition. We do highly encourage folks to use the most current edition of publications. Another great textbook is Berry and Cohn's Operating Room Technique. The most current edition of that one is the 14th edition shown for you on the screen. Now, these are pretty common textbooks in the perioperative arena, but one of the key concepts that we need to have knowledge of that is really not a focus of these textbooks is patient assessment. And because of that, we also highly recommend Drain's Peri-Anesthesia Nursing, a critical care approach. The 8th edition here is actually the latest edition. While this is a peri-anesthesia textbook, it really takes a deep dive into assessment. And if you think back to the subject areas of the exam, we do have to assess our patients preoperatively throughout the intra-op period, and then, of course, postoperatively prior to our handoff of patient care. So Drains is a great resource to help you if you need to increase your knowledge as far as patient assessment. Some other recommended resources, because the exam can include a variety of surgical specialties, you may need to brush up on your anatomy or physiology. So a physiology textbook, an anatomy coloring book, a lab or diagnostic test reference manual may be helpful. The AAMI standards, especially as it relates to cleaning, disinfection, and sterilization. Or a drug reference. An example could be Hippocrates. And we also want you to think about using your clinical environment as a resource. Thinking about all the individuals that you work with that you could gain insight and information from, such as our anesthesia partners, SPD partners, PACU staff, pathology, radiology, surgeons, woundostomy nurse. Here are a couple other optional resources. Again, these are not required, but we have partnered with Pocket Prep to have a CFPN app for studying with practice questions. And then we also offer at CCI a CFPN on-demand prep course that can be taken virtually at your convenience. Now, some other key preparation resources that we do highly recommend. First of all, make sure that you go to our website and download and really do a deep review of the CFPN Candidate Handbook. That's going to give you hopefully all the information you need as it relates to applying for the exam, eligibility criteria, scheduling your test with PSI, all of that information. Also, there's a few CFPN practice questions available for download, as well as that CFPN study plan that I mentioned. And you see a screenshot of that here. That study plan takes those subject areas and gives you targeted readings to focus on. Here are some other great resources to help in your preparation, such as the Joint Commission, the World Health Organization, the Malignant Hypothermia Association, the CDC, AHRQ. Now, I mentioned there's a few practice questions on our website that you can look at. And here's just one of those, just to give you a sample of what to expect. So with the questions, you have a STEM and you have 4 options. They are all multiple choice. So for this particular question, it says, which of the following statements is true regarding surgical site infections? What do you think? Is it A, only 10% of surgical site infections are preventable? Surgical site infections are now a key quality improvement metric? Non-modifiable patient factors contributing to SSIs include obesity. SSIs are no longer a major issue with modern surgery. Well, if you selected B, you would be correct. And here's the rationale. Even with sterile technique and all the advances, such as the use of antibiotics, unfortunately, surgical site infections continue to occur, and they present tremendous financial burdens and are a major pay for performance metric. And of course, we always have the reference for those as well, so you can go back and review and augment your studies. It's important to note that practice questions, though, while they are a great way to prepare, and we really do recommend that, sample questions will not appear on the actual exam. Now, let's review our 6th and final objective, those key processes associated with earning CFPN. Applicants can apply for CFPN by either creating a CCI account or logging into their existing account. Now, if you already have an account with us, but you're unable to access it, you've forgotten your password, what have you, please do not create another account. Simply reach out to us, either email us at info@cc-institute.org or call us from our phone number on our website, and we can reset your password and get you into your account right away. But please don't create a second account. Now, the application process will probably take you about 15 minutes. Some of the information that you want to make sure that you have when you get ready to complete that application is your personal contact information, address, homework, phone numbers, cell, email. And that email, you want to make sure that you use an email that you are going to have long-term, because this is going to allow you to receive communications from CCI, and your email is also your login ID. As far as your name, you want to use your legal name as it appears on your original, valid, unexpired, government-issued photo ID bearing a signature. You're going to want your RN license number, the state, and the expiration date. You're going to need your perioperative work history, the date that you started working in the OR, your current position and current practice area. You're going to need your employer contact information. the facility name, address, and phone number, your supervisor's contact information, his or her name, address, email, and phone number, your certificate of completion for your perioperative orientation course that needs to also include a date. And then, of course, if you are selected for random audit, the course syllabus detailing the didactic and the preceptor clinical components of your perioperative nursing orientation. And then, of course, payment. Now, the CFPN application fee, as of the time of this recording, is $195. We do encourage folks to always verify current fee structures on our website because fees are subject to change. Now, CFPN, again, is essentially a fast track to CNOR and CNAMB with lessened eligibility requirements. Again, being eligible at 18 months and 2,400 hours of practice versus 2 years. But earning CFPN is not a requirement to apply for CNOR or CNAMB. Now, when you apply, it's very important to be aware of your testing window. Once your application is approved, you have a 3-month window to schedule your remote exam. And your 3-month testing window opens the month immediately following your application submission. So, if you apply in November and your application is approved, your testing window is December, January, February. Now, it is the applicant's responsibility to ensure they schedule an appointment and that appointment is completed before the end of the testing window. And you may only test once during any testing window. So if folks are unsuccessful on exams, they cannot retest in the same testing window. Now, the results. Again, the CFPN, it's a remote secure proctored test. The exam is offered to applicants 24 hours a day, year-round, as permitted by PSI appointment availability. The exam is only available on your personal computer through PSI's Remote Secure Proctored Exam, or RSPE, platform. Again, this is at the time of the recording. Always check our website for testing options. Now, we talked about the exam. It's 120 multiple choice questions. Now, of those questions, only 100 are used to calculate your score. The remaining 20 are pre-test questions and do not impact your score. But they're dispersed throughout the exam and cannot be identified. So you need to answer all 120 questions. The exam is timed, and it does need to be completed in the 2.5-hour time frame. The computer hosting the exam will be the official timekeeper. And the computerized format of the test does require some basic computer knowledge. Now, we've already mentioned there's an optional pre-exam tutorial that gives you instructions on how to take a test on the computer. It'll give you examples of how to select answers, mark questions you may want to return to, and review before you finish your exam. The time allotted for that tutorial is separate from the actual exam time. For the CFPN exam, there is one reported pass-fail decision score. Now, the scores are determined by converting the number of questions answered correctly to a scaled score, ranging from 200 to 800. You need a total scaled score of at least 620 to pass. Now, applicants should therefore answer all questions on the exam because any question not answered could count against your final score. Now, that scaled score, it's neither the number of questions you answered correctly nor the percentage of questions you answered correctly. A scaled score is transformed from the raw test score, which is the number of test questions answered correctly. And the reason for this is it allows for consistent scoring across multiple exam forms. Immediately after you complete the exam, you will be shown a pass or fail notification. The CFPN only has a single take option. So if a candidate is not successful, they will need to reapply and submit a new exam fee. If they are unsuccessful, they will get a score report that will break down the various knowledge areas or subject areas of that exam so they can see where they performed well or maybe where there's some opportunities. And hopefully they can use that to inform their next study plan. Now, before we conclude, I want to talk just a moment about an extension year. An extension year extends the time your credential is valid by 1 year. So it allows you 1 more year to either meet eligibility requirements such as current employment or prepare yourself, study a little more to obtain either the CNOR or CNAMB credentials. During this time, your CFPN credential remains active. So if you need information, once you've earned your CFPN and you need information about an extension year, simply email us at info@cc-institute.org or call us at the number on the screen. An extension year is only available once for each CFPN credential holder, and the cost at the time of this recording is $50. But again, always verify fee structures on our website for the most current information. You must apply for this extension year if you need it prior to your CFPN credential expiring. And again, it adds 1 calendar year to your original expiration date. Outside of that 1 year, no additional time will be granted, and there are no refunds or discounts applicable. Here are some key CCI staff along with their emails if you would like to reach out. I'd like to thank you for your time and attention. As always, do reach out if we can be of further assistance, and we look forward to partnering with you on your professional development journey. Thank you.